I'm Gail Trauco. Welcome to Healthcare 911. Today we're continuing our chat with Dr. Christine Ren-Fielding and Dr. George Fielding from NYU. And we're going to talk about surgery aftercare today. We've talked about lots of different surgical procedures. What should a patient expect with their physician and once they get back to that home environment? What's important for them to know?
Well, they certainly have to come back for their post-operative visits, which is once or twice in the first month. But then the work really starts, where they're coming in anywhere between once a month to every 3 months for the first year or two, and then annually thereafter. And depending on which operation you have will determine how frequently you come back and what sort of testing is performed or what procedures are performed in the office.
So are they going to see the nutritionist when they come to each of your visits? Is that a scheduled appointment? And what's the likelihood that that patient may see some weight gain after that procedure?
I think it's very typical that patients lose a nice amount of weight in the immediate post-operative period. They often are on a liquid diet before the surgery for the sake of their liver, and they'll lose some weight. It depends what procedure. I don't think if you have a bypass or a sleeve, you don't typically get the weight regain early on. But with a band, for sure, the swelling goes out after the surgery, and the band's just sitting there. It's not doing anything.
How many of these these surgical procedures are overnight in the hospital, and how many of them are done outpatient right now for patients?
So the band is outpatient. In our practice, the sleeves typically stay one night, and the bypass typically stays 2 nights. But that's variable around the world, but that's certainly our practice.
I have an insurance question. Are insurance companies covering these procedures? They did not cover my lap band. I paid cash for it many years ago.
So insurance coverage is dependent by the state and by the carrier. So there are certain states where no insurance companies cover bariatric surgery. Even in states where the insurance companies do carry coverage for bariatric surgery, they have many, many requirements. So it's not that I'm 100 pounds overweight, I have diabetes, you can have surgery. There's many different things that are involved that you have to prove to the insurance company that they then will decide whether they'll cover your insurance.
Do you ever have patients who have had bariatric surgery who are non-compliant with their visits and show up in the ER with a complication?
Yeah, it happens. It's not a common thing. I think the non-compliance is more common than you think it might be. And I think it's particularly so with operations where there's not that much happens when you come for the follow-up. The difference with the band that we've really worked on in our practice and tried to teach others as well is that the follow-up is everything. Because if you don't come back, I can't adjust your band. And if I don't adjust your band, it's not going to work. So the follow-up with band surgery is a very proactive thing.
So if a patient lives, say, 3 to 4 hours away from a lap band surgeon that needs to follow them, that may not be, and they can't come for follow-up, that may not be the right bariatric procedure for them.
That's something that we very strongly point out, is that if you want your lap band to work, then you need to be prepared to come in once a month for at least the first year. And then it'll be less frequent. But if you cannot make that commitment, and it's not a judgment, but whether it's distance or time or you're busy with 10 kids, then you should probably have a sleeve gastrectomy or a gastric bypass, because in that manner, your visits are only every 3 months. And those visits will not only involve weighing you and seeing the nutritionist, but also checking your vitamin levels, because those 2 operations are really affect the vitamin levels that you're absorbing and what your levels are. Sometimes you have deficiencies with those operations.
Of all the bariatric patients that you see for the many different procedures that you do, statistically, is there any one procedure where the patients are less compliant with coming back for their post-operative care?
That's a very good question. I would say it's the resectional procedures because they say, what have I got to go back for? I'm doing okay. Nothing's going to change. At least in our practice, the band patients know that if they don't come back, it's all for nothing. Whereas the bypass and sleeve patients, they're doing all right, particularly in that first sort of magic 6 to 12 months. And then what happens is if they start regaining weight, and then they say, oh my God, I can't go back, Fielding's going to yell at me. So they don't come because they're embarrassed, sad, angry, and they stay away. At least with the band, if, you know, they have to stay away for a few years, but they know if they come back, I can adjust their band still years later, and it's going to work.
Well, I think that patient-physician relationship is very important. I'm a nurse. I'm in clinic 5 days a week at a hospital somewhere in the U.S. So, especially for a bariatric patient, because I know that there is well-constructed an emotional component, you know, with the overeating. So thank you for joining us today. This is Healthcare 911.
Been a real pleasure. Thanks.
Thank you.